So, Dr. Turner, you just mentioned in their practice that you sometimes use opiates, but many times you use other medicines and other modalities. Could you elaborate on that a little more?
Sure, I'd be glad to. There are other medications. When you look at the pain, the condition of pain, there are a lot of different ways to get after that. That may be opiates, that may be other medications that work on that pain signal from different mechanisms. And so we try to optimize those medications as well. And then often physical therapy is really important in what we do, getting the kids back moving, but doing it in a way that doesn't overdo it, and then they set up another pain problem. And so that pacing piece that goes on. We also use other ways to deal with, again, looking at how that pain is impacting their life, and can we give them tools to be able to have control and get back into school. We work with the school systems to allow the kids to have maybe a break or to be excused from PE or any number of things to help them get back to maximum function.
So it's clear quality of life becomes a key thing, and it's far more to pain management than just an intensity number.
Exactly. And when I talk to families, I ask a number because that's where we've been taught. However, what I really get after is what's the function of the child and how much is that impacting. And then after that, I generally don't even ask a pain number because it is only a small piece of the pain assessment. We have to look at what has been done previously. What are we doing now? Has there been progress? Do we need to change the treatment plan? Those kinds of things. And so the number, some people, children included, the number's just a number, and it really doesn't tell us anything. And they may say, oh, my pain's 6, and then they do a lot of things, and it's still 6, and they do a lot of things. And then when you go back and say, but remember when you came in the first time and it was a 6, and you couldn't do this, but now you're doing this and this and this. And it's like, oh, okay, maybe it isn't a 6.